We're going to do the CLEERLY CT scan, take a deep dive, look under the hood for my heart. This is my first time doing it.
Being fine is not good enough. Everything clogs up, and that's when you have a heart attack.
Oh, God.
How do I look like this on the outside, but on the inside I'm literally rotting away? The amount of radiation we give you is about 10% of what a regular CT machine is. Gotta look under the hood.
Look under the hood. I love that. We're here at CT Radiology and Research. I'm going to be getting a CT scan of my heart. This is my first time doing it. Now this is a little bit different. This is the CLEERLY CT scan. So this CLEERLY CT scan really takes a deep dive when we're talking about looking under the hood. And you can really see the actual percentage of blockage you have in the vessels. And it looks at three different things. It looks at the calcification, right, which is the calcium buildup. It looks at soft plaque. And then it looks at the worst one, the low density plaque, which is more of that hard plaque. We're gonna see how much blockage I have in some of those arteries, vessels in my heart. Hopefully it's good. You know, that's what I'm hoping for. I do take care of my health, but if it's not, we know I have all the different services and modalities and technologies to be able to hopefully reverse anything that I find that's not, you know, within optimal range. So stay tuned, you're gonna see a lot more of how this procedure goes. So now I'm actually gonna have to take this pill. My resting heart rate, unfortunately, is at like a 74, and it has to be at like a 65 or so, right?
60 is like the magic number.
The magic
but
number.
65, because of the speed of our machines, is still good enough, but 60 is the optimal number.
Okay.
So I'm gonna give you this beta blocker, Metoprolol, and what this does is it just lowers it slightly, and then that'll get us a nice clear picture, because what can happen is if the heart is beating too fast, we get a blurry picture. It's like taking a picture of a fast-moving object. You see a little bit of blur. Yeah.
So I gotta take okay, so it's three things here.
Yeah, because they're very low dose.
Okay, so all three.
Yeah.
All right, 1, 2, 3. All right, that's it. I'm a pill popper.
This is our fitting room where we have patients put their stuff. It's another dressing room. This is one of our rooms where we'll have him stay in. And that's just more hallways.
And this is the hallway?
Yeah, he's gonna be doing an exam on that last door. But right
That
now.
last door?
Yeah.
Here, if you want to have a seat here.
Wow, look at this thing.
Yep.
Is this real?
Very real.
You guys hunted it?
My grandfather.
Wow.
Oh, you didn't tell me it was real.
That's very real. If I show you everything he does. Bobcats, that's my daughter. What else I got in here? See? More bobcats, more lions in the background, bears.
Man, he does that like,
He has over 200 animals.
wow. Does he stuff them himself?
No.
He has somebody who does.
It all gets done in Africa. Or wherever he does it.
Yeah. And one thing led to another, man, and I got very deep into the longevity functional medicine world.
Yeah.
I got into the functional medicine world, think about it, that was when I was 19, so almost 2 decades ago, when nobody was talking this.
Yeah,
nobody was
nobody.
talking about genetics, about all this testing.
Yeah.
I was learning from this heart surgeon, and I was just learning and hearing him talk about all this stuff that most people, if you talk about it, they would have thought you were quack.
Yeah.
You know, but I started seeing it firsthand. It's like, yo, this guy's reversing people that are sick. You know, people with cancer and heart disease. Whatever he's doing, that's the side of medicine that I want to be on.
Exactly.
My goal was to make it a little bit more trendy, more hip and cool, something that people don't feel like they're going to the hospital.
Right.
And it just took off. I'm on the pharmacy side. We distribute our proprietary IV therapy product to over 5,000 doctors in the wellness space. I got one of the top health and wellness podcasts. For me, it's not about the money. You know, obviously I don't run the Mother Teresa Foundation, so I want to make money. But it's ultimately like following my purpose, you know, and it's really to help people in the time of need. So I'm in it. I'm really in this industry.
Yeah, and I can relate when you say people think I was a quack, whatever. It's funny because when I was in college, everybody's up drinking beer at all the parties, you know, keg stands, all that stuff. And I was the only one that would never drink alcohol. I was like, who's this weirdo? And now all my buddies who have recently turning 40, all of them are like, man, I got fatty liver disease. I got this. I'm like,
They're
there you go.
moving back.
And now all of them are like, man, you were onto something 20 years ago.
Mm-hmm.
The way I got into health is when I was senior in high school, I worked at McDonald's. And after that year of working there, I graduate high school, and then it's time for my yearly checkup. Doctor does my blood work, and doctor's like freaking out, like, what the heck's going on here? I feel like I'm looking at a 60-year-old diabetic, overweight patient, but clearly you're a high school athlete. What's going on? And then I told him I work at McDonald's. He's like, oh, that explains it all.
You've been breathing
Because I was
in
eating it
Oh, you're eating it
every
too.
single day of my life, pretty much. Because I was working there, and I would eat for free, and it was next to my house. Being 18, being an athlete, I wasn't really feeling the full effect of everything that was going on. So
You didn't think about that.
my liver enzymes were super high, cholesterol was through the roof, triglycerides through the roof, inflammatory scores through the roof. Everything was just messed up on the inside.
Wow.
So I got super into health because I was fascinated by, like, how do I look like this on the outside, but on the inside I'm literally rotting away.
Wow.
I wanted to be a doctor, and I went to work at an imaging center, and then I realized being a doctor was not for me. I just love the technology, and it was fascinating looking inside of people's bodies and seeing what's really going on. And how this is actually more, I don't want to say it's more important than a doctor, but without these tools, the doctor doesn't know what to do next.
Yeah, 100%.
Like,
right.
this is like the first thing we got to do to understand now what to do next.
Yeah.
So I got way more interested in the imaging side, and then after a few years, I learned the whole business, and I decided to open up my own centers.
Nice.
Yeah.
That's amazing. Amazing.
He's my partner. So he takes care of all the medical. I take care of the new technology coming out, growing the business, making machines. The machines are top of the line.
Nice.
And I go after all the research contracts. And like Cleerly, for example, I'm the one who went after Cleerly. And I was like, hey, I know you guys are coming out with this. We have the right machine and equipment for this. Let's install this software.
Were you one of the first ones that tapped into that? That's amazing, man.
We were one of the first ones, and we were the only ones doing it because the hospitals, they're big corporations, and you need board members and this for approvals.
Right.
They took over a year to get approvals done for them to start doing it. So we were the only ones doing it for about a year, and then finally a couple hospitals around Miami started doing it. But in the outpatient center, obviously we're not a hospital, in the outpatient center, we're still...
You guys are it. Yeah, this is time for you to hit it hard. All the cash, people will pay out of pocket for this.
Everybody's paying.
Easy.
Some people even tell me it's too cheap. Some people tell me you're charging too cheap. Because essentially what we're doing here is we're getting the same information as if you went into the hospital and did what's called a cardiac catheterization, where they go through the artery in the vein, and they stick a camera into your arteries, and they measure and see how much plaque you have, and they see how much pressure is flowing through each artery to make sure you don't need a stent. All that information, we give it to you based on a 3D scan. How people used to read these studies in black and white. So now we have AI power to create the 3D model and be able to color code every single different types of plaque. Because that obviously only a radiologist can understand what this is. And even then, they can't give you exact measurements like 35% stenosis. They would tell you, oh, it's between 30 and 40%. They give you a range because the human eye can't be exact and measure the way this AI model can. Here's an example of a 46-year-old cyclist who was in great shape, thought he was fine because he had done a calcium score with us 2 years prior, and the calcium score was 0. So when he came back 2 years later to do a follow-up, we scan him, and I tell him, guess what? You're right, your calcium score is still 0. The problem is you got soft plaque and low density plaque. So here, yellow is soft, and red is low density, super dangerous. Blue is calcified. There's no blue here because he has 0 calcium. So a lot of people sometimes get a calcium score, and they're like, oh, I had a calcium score of 0, I'm good. Well, are you really?
Well, they still have blockage.
Right, because they don't know. Because the problem is calcium score will only catch calcium. That's it. So it doesn't go in depth. Picture this like a pimple. Pimple starts growing, then it bursts. What happens? It clogs the aorta where all your chambers are. Everything clogs up, and that's when you have a heart attack.
Oh, God.
So what this patient does is he gets on statins, and it helps regress plaque. So then we can measure you again now, 6 months or a year later, and now we know, hey, you went from 35% to, let's say, 25%, so we know it's working.
Dr. Davis, my partner, he does with a lot of his patients, when he gets the results, he does plaques. He does the IV and also oral.
Oh, and oral.
Depending how aggressive he has to go.
Okay, so the interesting thing would be those people that he puts on plaques, do this, measure, do your treatments of plaques, and then come back and measure again.
Right.
Right, it's measure, intervention, measure. This is the cool thing, you know? We can scroll through this and see.
And you go all through the whole...
Yeah, so you see, this is a clean artery. And this area right here is all messed up. This guy's real heart modeled. This is not like a generic model. This is the real model of this person's heart. And then the yellow highlighted artery is the one we're looking at. And this orange slice here, this slice is where this orange line is going through.
Okay, I see.
So you see as we go up, the orange slice goes up.
So is this looking at the valves on the side of the heart too?
No valves.
This just looking at...
That's an echocardiogram.
Okay.
Think of your heart like a house. You got the plumbing, which is the arteries. That's the most important thing. If the plumbing gets clogged, the valves can't pump and you're dropped out of a heart attack. So you got plumbing, which is your arteries. You got the electrical system, which is an EKG, right? You put all the EKG to check that the electrical system is good, that it's sending the signal and your heart's pumping correctly.
Right.
Then you got doors and windows, which that checks the different chambers in the heart.
Right.
So you want to make sure you don't have any leaky doors or leaky windows, that everything actually shuts and opens perfectly.
Right, right.
So that's how I kind of try to simplify things. Think of it like your heart like a house. Yeah. Electrical, plumbing, doors and windows.
I like that. That sounds a good analogy.
And the plumbing is the most important one.
That's the one we're doing today.
So that's what we're doing today. We're going to check your plumbing.
All right. So the contrast, what's the purpose of the contrast?
So as the contrast flows through the arteries, it highlights the artery.
Okay.
So then, for example, here you would see a perfectly white cylinder. When you get here, you see like the contrast kind of like flow differently. So we know there's some issue going on here. So that's the purpose of the contrast. It'll highlight and brighten every artery.
Now, I've never done contrast, but I hear people feel funny on the contrast.
Maybe. The good thing here is because we have such new technology, we don't have to give you as much contrast as a typical dose.
Okay.
So we give you less.
All right, I like that.
Yeah. Again, the best part is the machines we have. People, oh, I don't like radiation. The amount of radiation we give you is about 10% of what a regular CT machine is.
Okay.
So you're getting a tenth.
Now, some of the technologies, like we were talking about the full body MRI, that one doesn't have radiation.
No, it's all magnet.
It's magnet.
Magnetic resonance imaging. It's all magnets. So there's no radiation there.
Right. What age do you recommend doing the CLEERLY?
40.
At 40.
Unless you have familial history of people having heart attacks in your family, like a father or grandfather. If you want to do it a little earlier,
so I'm
you
still
could.
too young. I'm 39.
You're right there.
Yeah.
You're right there.
Especially,
You're a firefighter,
my
though.
12 years of working in the fire department.
Were you in the homes fighting fire with the mask and the smoke?
Yeah.
Then
I've been retired for 7 years now, but you know.
So then you're at the right age. What most physicians are saying out there is like, if you're high risk, maybe do it at 35. If you're low risk, maybe start at 40. Kind of like a mammogram for women.
Yeah, I agree. I think this is something that firefighters should be more proactive in.
Every firefighter should be doing this.
They should do it early to get a baseline.
Yes.
See exactly where they're starting. You know.
Yes, because the thing is, once this starts building up, it's like a snowball effect.
Right.
Like if it grew, if you had 5% blockage in 1 year, the next year you might have 8% blockage, and the next year you might have 15% blockage. It starts exponentially growing. So check this out.
That doesn't look good.
Look at this, narrowing. Look how narrow this got. So
this is 73% blockage?
Yep. So imagine, walking, talking, he thinks he's perfectly fine. So as you see here, this one has blue, which is the calcium.
Okay.
But look at all this soft plaque he has here.
Wow.
This is Dr. Eber, my partner. You know, when we first got this, I brought in my family, he brought in his family. He does his dad, and he freaked out when he saw it. He's like, Dad, are you sure you feel fine? He's like, yeah, I feel normal. And this is the problem.
So you guys started an intervention quick on that?
At this point, it was too late for him. He ended up getting bypass surgery.
Oh, bypass.
Look at this. 95% blockage. He just kept saying, I feel fine. What do you mean I need a bypass surgery? Why? Even his doctor was like, oh, this is amazing. Where'd you get this done? I got to send all my patients to get the scan. You know, as a cardiologist, I'm failing you, the patient, because I think you're fine. Being fine is not good enough.
Right.
Got to look under the hood.
Look under the hood. I love that.
Let me check the other side. You want it a little lower, which is good.
Well, what is it at right now?
70.
That's
and then,
it.
Yeah, it went
pills,
down.
only 70?
It went down. It went down 5 points. You're fine. Oh, fair. We're gonna do a lung on him. Since he was a firefighter, we'll check his lungs, and then go a little lower because he has like a hernia or something.
All right.
He has like a little bulge right there. So if you can just go kind of the top of the abdomen. All right, Samuel. On your back, get right here. Sure.
Right. Raise the legs up. Let down. Make yourself comfortable.
All right, we're gonna do the CLEERLY CT scan. Take a deep dive, look under the hood for my heart, see how much plaque buildup I have in there. The calcification, right? Type of plaque. We got the soft plaque, and we got the low density plaque. Hopefully, we don't have much of that one for sure. So, this is what the future of medicine is all about.
All right. Going in. No move. Nice. Beautiful. Okay, so we're getting our EKG connected here. Let's see where the heart rate is at. Be nice and relaxed. Oh, beautiful. Got you down to 68, 70. That's good. Now I'm gonna give you another 5 milligrams of Metoprolol. Right, that's the tablet you took. Just to control the heart rate. Okay. Samuel, just give me a thumbs up if you're hearing me. Okay, great. So we're going to get ready for the cardiac. 63, 64. Take a breath in and hold it. Breathe normal.
That was good. We got it down to almost 58, 59.
Oh, wow. Yeah. Here comes the contrast.
That was good.
So we got an excellent.
When you were doing breath hold, we got you as low as 59.60,
That's where the contrast
which is that's what's optimal.
Just finished here at 3T Radiology and Research. Man, I tell you, when that whole contrast hit, you just feel it, this warm feeling. It was my first time doing it. So it's this warm feeling all throughout the body, but it only lasts a few seconds. And those few seconds make this what's worth it. We're gonna get the results. We don't have the results yet, but it was a smooth process. Overall, very nice people here. They brought the hospitality to the table, make sure that I was comfortable. There's a lot of moving parts, IV had to get started, etc. But this is what we call looking under the hood. There's certain ways on how to look under the hood, but there's real ways on how to look under the hood. This is the real way to look under the hood. So stay tuned for the rest. This scan utilizes a technology called CLEERLY, the CLEERLY AI technology. So today we have Dr. James Min and Humberto Carrión. All right. Amazing. Welcome to Healthy Point of View podcast. I had the opportunity to do the scan myself. Maybe we could pull it up and kind of go through it and understand what we're looking at when it comes to the technology that's being utilized. What does the CLEERLY Heart Scan really do and why people should utilize it?
The goal here, like in what you're seeing here, is about 5 or 6 different AI algorithms that have extracted all of your heart arteries out of the scan and then done a microscopic analysis on this at a very personalized level. The innovation is in the obviousness of what we should be doing, which is measuring the actual disease rather than surrogate markers of disease. So the actual disease is the plaque. Fortunately for you, you have virtually none, which is great.
That's good.
Yes, like you look like you have the arteries of a 14-year-old kid, which is great.
That.
Yeah,
awesome.
But what you can see where Humberto is pointing out is there's a tiny little bit of plaque, and you can see that it's yellow and it's blue. Some plaques are the strongest predictors of who will have a heart attack or not. That's the ones that we color code red. You have none in your heart. The yellow plaques are sort of the